So there is one more thing na ki like sometimes surgeon do two incisions, one in front of.
There. It is called OCCI. Now, what I
Okay.
do here is, suppose there is a surgeon who doesn't have access to arcuate. So, what you can do is, if you know your SIA, how much of astigmatism you induce, you can make two incisions.
Right.
So, this is, I'm correcting 0.75 astigmatism at 60 degrees. So, this case has 0.60.
Right.
Now, OCCI means opposite side clear corneal incision. So, you will notice one incision is used from one area. That is my steeper axis. I don't want to use a toric lens for 0.75. Now see, at the same axis, I'll make another incision opposite side. Now these two incisions have a coupling effect. That steep cornea suddenly becomes, because this area has become loose, it starts flattening. So there is a cumulative effect. If your SIA is 0.22 and you make two incisions, you can correct up to 0.75. They are more than synergistic. Not a total addition, but more than addition. So 0.2 should be equivalent to 0.4. But if you make two incisions, you can correct till 0.6, 0.7. They have an additive effect.
Okay.
So this is called OCCI.
OCCI.
So this is also used for low level astigmatisms. Now, the cat in the kitchen, when to use OCCI and when not to use OCCI.
Right.
If you have a with the rule of astigmatism, and if it is not much, don't touch it. Don't touch with the rule astigmatism, because there is another against the rule astigmatism sitting back, which is already correcting it. If you correct this, this will manifest.
Right.
So, PCA is very important. Something very technical. Vertically, anterior cornea is steeper, but this astigmatism is called with the rule.
Right.
Posteriorly also, the vertical cornea is steeper, but it is called against the rule. Nobody's bothered to ask why. This was a question when I was teaching. One of my students asked me, sir, why is it when both the situations, this is steeper, but anteriorly it is called with the rule, but when it goes posterior, it is called against the rule. The reason is the refractive index of the air and the cornea is from a rarer to denser. And the posterior surface cornea is from denser to rarer. So the posterior part of the cornea acts like a minus lens. The anterior part of the cornea acts like a plus lens. So the minus lens reverses the... So if this posterior part is vertical, now this is not with the rule. It is against the rule. But if the anterior part is vertical, it is with the rule. So अगर आप हमेशा विद द रूल एस्टिग्मेटिज्म को भी करेक्ट करने की कोशिश करोगे तो आप ओवर करेक्ट कर दोगे. और जो व्यक्ति, the person who's lived his entire life with slight amount of with the rule, if you change the axis and make it against the rule, he's going to be very unhappy. So again, one reason why beginner surgeons suddenly are seeing that हमने तो astigmatism पूरा करेक्ट कर दिया, ऑटो रिफ्रैक्टोमीटर में तो जीरो आ गया. Right. Patient is not happy. You have corrected their against the rule astigmatism of the posterior curvature also, which you have not caught. You have not counted. Cornea is absolutely symmetrical. Refraction is symmetrical. Patient is unhappy. Because you've induced a new astigmatism which the patient has never experienced before. From this to this is not experienced. So this is again something to be taken care of.